live? Okay. Hi guys, it's Leah and Dr. V here. We are doing a procedure today on Donna. Donna? Say hey. So we're going to be doing some PDO threads today. We're going to be doing Donna's abdomen. So Donna, kind of sit up for us just a little bit. So she just has a little bit of crepey skin. She's thin, but she's just had a little bit of loss of elasticity to her abdomen. So we're going to really do the threads to kind of help lift this. We're going to help get rid of some of this crepiness. And then we're going to do the same thing
for her knees.
We've
done one side already.
So we're going to kind of show you the technique.
Yeah.
PDO threads can be used in multiple different locations of the body. So they can be used on the body itself, on the face. They can be used to lift the jowls. They can be used on the neck. They can be used on the butt, on the thighs, on the knees, abdomen, on the arms, really anywhere. It is going to be a permanent suture that dissolves over the course of about 9 months and leaves collagen where the thread once was. It's relatively painless. We numb you. Yeah, so viewer discretion advised. There might be some blood, but we'll kind of try to keep it at a minimum.
And I mean, it's like a lunchtime
thing. No
like,
downtime.
There's no downtime. You just come in, we do it, and then you can go and do whatever you're normally gonna do.
Yep.
I mean, most people don't have any pain.
No.
No
discomfort during the procedure or after. The only kind of aftercare is that you just can't do saunas or just saunas or infrared.
Yeah, for like 2 weeks.
2 weeks after.
Yeah.
No really hot temperatures. So.
Or lifting like I would tell Dawn not to like lift like really heavy weights because we want that thread to really pull.
There's no chance of that.
Like not do a lot of like squats, anything that's going to kind of use this muscle or disrupt where the thread is until they kind of get healed and scarred in.
So see, we already did this thread, so I'm just cutting this. And so I'm just cutting that. And let's just wipe that off and it's all gone. And does that feel like anything, Dawn?
No, not really.
Okay.
Perfect.
So it will just kind of, what's nice about threads, and it's really common in the East, you know, in the Far East, they use threads a lot for everything. Like the threads are going to sort of get collagen around them, and if you do like a sort of cross section or look under the microscope, you'll see collagen developing around the threads. And we can do more. We just did 3 barbed threads around here. But we can do more. We can do smooth, whatever. But you can already see there's a difference between here, where we haven't done threads, and over here. And this is an immediate difference. And then in 6 weeks, you're going to see a bigger difference, and then more of a difference in a few months.
Yeah. So should we start with this one?
So we're just going to make a little indentation. We've already cleaned
and numbed the area.
Yeah, we've already cleaned the area because we're very particular about making sure
it's clean.
It's clean. And put the thread in here.
And this is a barbed thread. So this is a thread that's going to have tiny little barbs coming off of it. The tissue, when we pull back on it, the tissue is going to kind of attach into those barbs. And as the collagen is forming, it's going to form around that barb in kind of a lifted way.
That's it. That's your thread.
I didn't feel anything.
So, and if you can see, so we kind of lift this, it's lifting the skin. As this kind of sits in here, it'll even like lift more as the collagen forms around it.
Donna, can you ask Donna if she felt anything?
Donna, how's it feel? Can you tell me?
I didn't feel anything on that one.
Perfect.
And do another little one over here. So we're making a little hole, and this is a little cannula, so it's blunt. So what's nice about it is you're not really creating, there's no damage really to tissue, so you're going in a little plane.
So it just separates the tissue but not cutting it.
Yep, exactly.
Right. And one more.
Let me go
Mm-hmm. I'll do it.
right here.
Mm-hmm. So you're just making a little room for.
Get it?
Mm-hmm.
And I think this is such a common
Area.
area that women are dissatisfied with.
And they feel like there's really nothing they can do
There's
for
very
it.
little you can do for it. Yeah. Other than this.
And then you just snip off these threads and they'll stay in place.
Perfect.
So while you guys are doing this, what would you say are the most common areas for threads?
We do a lot of jowls. We do
Jawline.
a lot of jaw lines. We do a lot of faces. We
Necks.
do eyebrows.
Eyebrows, the brow
That's the
lift,
biggest thing now. What we just did, Winnie's. We're gonna post those pictures.
the fox eye.
Like on side.
Yep.
We do boobs.
Boob lift.
We do. So we do everything really, but faces are a big one. We
I
do
would
it
say
in
the
conjunction.
jawline and the neck are probably the most common areas.
Yeah, and I mean we do it in conjunction with filler, so it's just another sort of another arsenal in
Yeah.
our toolbox.
Toolbox, yeah. Yeah.
So
Can you do buttocks?
yes,
You can.
we do butts. Yeah.
Yes.
Butt lifts.
And it is threads typically tend to run a little bit less expensive than filler. Obviously, one treatment is not superior to the other. You really need a combination of both. But especially when we're talking about the jawline, it takes so much in that area, and so we usually like to add threads on because it tends to help lift things a little bit without laying so much filler down.
This is another type of thread. This is a smooth thread, and it's really long. This is like 2.5 inches. So we're gonna do Donna's abdomen now, and we're gonna just lay these smooth threads over here to help with some of the crepiness and help build collagen.
Yeah, because if you guys remember when she set up, it was kind of, she had this number going on. And so we're hoping that by taking up some of that slack, she's going to have a nice smooth abdomen.
And it really does build collagen. We do a lot of that in the neck, you know, for that crepey skin.
Yeah.
So we're gonna do that, and then we're gonna pull these
With
areas up
with the
some
barb
barbs.
threads.
Okay, so these are relatively simple. Just put that in.
And is this into the dermal layer?
Mm-hmm. Subdermal.
Subdermal.
Donna, do you feel anything?
Not much at all. And I feel like a little tugging, very slight pinch, to be honest, but it's not much at all.
This is the longest smooth thread that we use. Usually we use
A short little smooth thread, which we can use for some of the fine lines like the nasolabial folds in the lips, around the mouth, the perioral area. That's where we use a lot of just tiny smooth threads.
What would you say the main difference between a smooth thread and a barbed thread is?
a barbed thread has these little teeth.
Yeah,
So it kind of hooks on
To the tissue.
and gives a pull. A smooth thread is just sort of laying in the tissue and it's creating collagen. It
Around
gives
it.
you a little bit of a pull, but not much.
so I would say that, like, in general, I would say barb threads are more for, like, lifting and pulling, whereas smooth threads are more for volume
And collagen.
and collagen. Yeah.
So, it's just a really cool
So
sort
the
of
smooth will
treatment.
help with the crepey skin.
Yes, the crepey skin smooth is the way to
There
go
really
for that.
isn't a whole lot you can do for crepey skin, you know? And so this is just sort of a nice, we put one in here?
Yeah, we did here and here.
Okay, so we're just gonna do.
And these are 27 gauge. smooth thread. So
I'm gonna try to keep it superficial because we want that superficial skin.
and that was very superficial. You can't feel anything under the skin. It doesn't look like anything's been done there at all.
One more over here, and then we may do one last one over there.
And she's not having any bleeding from these areas at all.
And then a lot of women have like this sort of pooch,
Yes, or the
this
saggy
sort of
skin.
saggy skin
Yep.
over here. So this is great for that. You can even lift right here, you know.
This way.
It's also great for like stretch marks, you know. So it would be. Put one there. I mean, I would even do them on myself.
Yeah, the smooth ones are very easy and quick to go in.
These aren't not bad at all.
You don't need to make like the pilot hole like we did for the barbed ones on the knee.
I
You
think
just go right in.
filler is more
Painful. Yeah.
And I mean, I've done them on myself for,
Yeah,
you know, just
yeah,
a little bit here and there.
yeah.
I
They're
mean,
easy.
I don't even use any numbing. Just,
The smooth ones are just so versatile. They can be used a lot in the nasolabial folds, even in the temples
You put
area
them in
for
lips.
hollowing, for the lips to kind of define the borders because you're gonna have some definition right when you put the thread in, but after the fact you'll have collagen that goes back and builds right there, so you'll really get that nice crisp defined border to the lip. Then on Donna too, like we could do, she has a little bit of crepiness on her neck, so we could use some smooth threads on her neck as well. You really don't have much though at all.
so we're gonna put a little barbed over here. So I'm gonna make a little pilot hole. Sometimes you have to make a slightly larger pilot hole, so. Alright.
The barbed, what are those? Are those 23 gauge?
This is 18.
18? Oh, those are 18.
Yeah, barbed is usually a little bigger. That will pull nicely. So basically we're going to put one more over here.
And then same thing on the side. beforehand, I think we said this, but beforehand um, we did do topical like lidocaine numbing.
So.
When the lidocaine wears off, do people feel anything?
No.
Not typically.
It's a little thicker skin, and
She also has a little stretch mark right there, which
Yeah.
probably should probably have some fibrous tissue.
yeah. It's funny when you're in the abdomen, you can feel all the. You're kind of breaking up that fibrous tissue.
So you can see this pull on both of these.
Yeah, it's really nice actually.
I can see a little difference from one side just to the other,
Yeah.
just on those.
Like right here is much smoother than.
Mm-hmm.
That's exciting.
Yeah.
And remember, you're not going to see the difference right away. You're going to see the difference over weeks, but you will see some, which is nice. So.
Yeah.
Yeah.
Is that it?
We were going to do 2 more over here, but.
Okay.
Yeah.
Yeah. So, do you guys have any questions for us? Anything about threads? We'll finish up this, and then we'll share some before and afters of Donna. Did anyone have any questions
I
about
can't
threads?
see the questions, but
Okay.
tell them
You
to
could
keep.
add some questions, and I'll finish.
Yeah.
Yeah.
So I guess to answer probably some of the most common questions, who's a good candidate for threads? Really, anyone's a great candidate for threads. There's really no one. Let's switch sides. Hold on, let me move in my heart. Switch sides.
We do threads for 80-year-olds, and we do threads for
Yeah. So there's really anyone's a great candidate for threads. Like we said, they can be used in so many different manners. They're usually, combined with some kind of filler or laser or something like that, but they can be used on their own. What else? How long do they last? So the actual thread itself is going to dissolve in about 6 months, but the collagen is laying down collagen, so those effects from the collagen last much longer than that. Most people find you're still aging as the collagen process is taking place, so most people find they want to do, another treatment of threads probably in the next 9 months to a year, just to keep that collagen going.
And people do different parts of the body at different times.
Yep, exactly. Can you see these?
So the final results are about how long?
I would say in about 3 months. We're dealing with collagen laying down, so it's the same as any kind of collagen stimulation you're doing, whether it's through laser, through different old therapy, whether it's through collagen synthesizer filler, if it's through threads, PRP, same thing with microneedling. Anytime you're laying down collagen, it's a slow process, but usually about 3 to 6 months are when you're going to notice the max results. Mm-hmm. And everyone's a little bit different because everyone has a little bit different rates of how their collagen is being produced. So it's really never too early to start doing something like this, especially if you're noticing a little bit of volume loss or sagging.
It's also sort of saying, okay, I want, an eye lift, for example. We have a lot of younger patients coming to us for that.
They don't necessarily need anything, but they want that extra lift.
Right. Or jaw. We have a lot of younger patients who are like, well, I want a more defined jaw.
Yeah.
You do a nose lift, to lift the tip of the nose. That also is something that we can do with threads.
Yeah.
And abdomen too. That's something anyone can do. So Donna, do you want to sit up?
Here, let me I unplugged the bed by accident, so let me plug it.
Do you want me to just sit up or?
I'll sit up.
I think it's a lot less crazy. But
We'll have you maybe stand up.
okay. So
What do you think, Donna?
I can't see
My mask.
right. I mean, we could even do more over here.
But yeah, actually,
Yeah.
I see a difference.
Yeah. And I mean, with the knees, we did lift some, and I think that we could do more with like smooth threads. We could do more like this way, and I think we could do that in the next sitting. But I think in the abdomen, we can definitely see a difference.
Yeah, and I think, in 3 months you'll notice even more of a difference.
Definitely, I see the crepiness so much
Yeah.
better.
Yeah.
Because we saw that crepiness, in initially, and I think that crepiness.
Yeah, because you were more like this before.
Yeah, it looks a lot smoother to me.
Yeah, looks good.
So.
Okay, guys, send us your thread questions.
Yes.
And then,
If you have any questions, you can just come in for a consult.
yeah, consult is the best way. There's so many different things that you can do. It's hard to know, like price, anything like that, until after we do a consult and kind
Looks
of see
really
what we can
good.
do.
Yeah.
And obviously, we can combine
Yeah, look in
therapies
the
as
mirror.
well.
Yeah,
It looks good.
I like it. It looks really nice.
Yeah.
Great, thank you.
Yeah. So let us know what you want to hear about next week.
Yeah.
If you guys like these demos like this, I think it's fun for us too,
Yeah.
because we're doing stuff we enjoy instead of just kind of talking to you guys.
Yeah.
So if you want to see a demo of anything specific, I think
Yes.
lasers or microneedling or
Just stuff that we do. That's.
yeah, that's good. So let us know and then send us your questions and we'll post them before and afters of threads. So be on the lookout for those.
Yes.
Okay, bye guys.